I think many of us from time to time we will feel that our eyes is irritated or dry. So does that even mean that actually we have this dry eye disease?
But actually, dry eye disease is a chronic condition and it's not a short-term issue. And its symptoms usually range from maybe we have mild symptoms to symptoms that may affect our daily activities. But however, it's always believed that the 15% of Malaysia population are actually affected by dry eye disease.
Hi everyone, welcome to another episode of MySelfCare Podcast. I am Kongzi, your host for today, and welcome Chun Yong for joining us today's podcast.
Thanks, Konza. It's always my pleasure to be here. So, can you tell me what we'll be discussed about today?
Okay, today we'll be discuss about a disease which is seldom we talk about, which is dry eye disease. So generally there's a lack of awareness about dry eye disease, and sometimes people think that it might be some other factors such as fatigue or allergies.
Actually, Konza, I hope what we discuss today will raise awareness about this dry eye disease and also its impact in our daily lives. And just now we talk about eyes, right? Since then, suddenly I remember this Olympic air shooter from Turkish, which is, I think he's 50 years old plus minus. His name Yusuf Daike. If you still remember, he went quite viral during this Olympic because of his casual attire, and he just wear standard glasses for his shooting event.
Yeah. He actually has a very good eyesight, and he won the silver medal actually for the event without wearing any blinder or visor.
Oh, that's quite impressive.
Alright, Chun Yong, back to our topics today about dry eye disease. So actually what is dry eye disease? Many of us actually think that dry eye is a short-term condition, but it's not a disease. So I think many of us from time to time we will feel that our eyes is irritated or dry. So does that even mean that actually we have this dry eye disease?
So, Konza, actually, dry eye disease, many of us, we occasionally will feel dry eye disease symptoms, and which can be actually relieved with over-the-counter eye drops just to lubricate our eyes. But actually, dry eye disease is a chronic condition and it's not a short-term issue. And its symptoms usually range from maybe we have mild symptoms to symptoms that may affect our daily activities.
So Chun Yong, I believe dry eye disease should be quite common nowadays. So is there any data or statistic that showing that how common dry eyes in Malaysia?
Actually, there was a study carried out in 2022, okay, which is actually a meta-analysis, so that included around 20 studies in Asia. So according to this meta-analysis, the dry eye prevalence among any Asia population range around 4 to 64%, if I'm not mistaken, and they conclude that the average of dry eye disease affecting any Asia population is around 20%. But if you look at Malaysia, our country, so there's no any study which carried out in Malaysia regarding dry eye disease. But however, it's always believed that the 15% of Malaysia population are actually affected by dry eye disease.
Okay, so how can someone know actually if they have this dry eye disease? So what are the common symptoms of dry eye disease that you can actually share to all of us?
Actually, the symptoms of dry eye disease may include stinging, itchy, or burning sensation of the eyes. Okay, sometimes may have a sensation of something inside the eyes. Also, eye redness, irritation, mucus inside or around the eyes, blurred vision, and also even excessive tearing. Okay, some people may think that excessive tearing is not a symptoms of dry eye because it's kind of like contradict, but actually it is a symptoms of dry eye disease.
Remember everyone, if you have these symptoms, so you might have dry eye disease. So the symptom sounds simple, but actually it's important to take note of them. So you may actually visit to your nearest GP or visit eye specialist. Alright, so Chun Yong, what leads to dry eyes? As I know, the most common one, it will be the frequent usage of digital screen like handphones, laptops, or televisions.
Yep, correct. That's correct, concern. But first, we have to look at how dry eye disease happen. Actually, dry eye it occurs when our eyes don't produce sufficient tears, or when the tears produced are of poor qualities. Okay, some other factors that may increase the risk of dry eye may include like aging, environmental condition like windy or dry air, okay, frequent usage of contact lenses, having laser eye surgery, and some medications or medical condition may cause dry disease as well. So let me ask you a question, Concern. Do you think dry disease can be cured?
Okay, since you mentioned dry eye disease is a chronic disease, so
Yes.
I think it cannot be cured. So I believe that the symptom maybe can be relieved by some medications.
Yes, Concern, actually you are correct. Actually, dry disease cannot be cured completely, but like I mentioned previously or just now, okay, sometimes mild dry eye disease may be elevated with over-the-counter eye drops. Okay, but if let's say the dry disease is caused by an underlying medical condition or maybe due to medication, so it's best to visit your GP or your doctor to review your medication or have a look at your medical condition. Okay, sometimes prescription medications and also some surgical procedure may be recommended for a severe dry eye disease. Okay, and a fun fact, okay, omega-3 supplements may help to reduce the symptoms of dry eye disease actually.
Oh, omega-3. But how does omega-3 actually help in dry eyes?
Okay.
As I know, omega-3 has an anti-inflammatory effect, so it must be something to do with inflammation.
Actually, yeah, you are correct, Konza. Omega-3 do help to reduce inflammation, as inflammation is actually one of the underlying causes of dry eye disease. And other than that, actually, omega-3 also help to improve the quality of oil secreted by the meibomian gland in our eyes. So actually there are three layers of our tears. So the outer or the external layer is actually the oily layer, and then the middle one is actually the watery layer, and then the inner layer is the mucin layer. So with better quality of the oily layer, this can reduce the evaporation of our tears, hence keeping our eyes lubricated.
I see. So if you guys decided to take omega-3 supplements, so it's better to consult doctors or pharmacists first, so that they can ensure that omega-3 actually is suitable for you and safe for you.
Yeah, it's better to consult your healthcare professional before you take any supplements.
Okay. Thanks, Junyong, for sharing with us about dry eyes disease today. So I think starting from today, I need to reduce my time on looking at the phone and also laptops. So Junyong, before we end our session, today's session, is there anything you want to add on?
Okay, thank you our audience for listening to this podcast. So remember to pay attention to dry eye disease symptoms, and then let's say if you have any concern or you think that you may have dry eye disease, don't forget to always consult your healthcare professional, your GP, or and also your maybe eye specialist center.
Okay, so guys, if you think the information we share are helpful, so don't forget to share to your friends and family.
Okay, please also like this video, subscribe to our channel below, and for more healthcare information content like this. So until next time, see you all.
Okay, bye.